Hi guys, welcome back to my channel. I am Nurse Babe Britt, and in today's video, I'm going to talk about what it's like working in the CVICU. So if that's something that interests you, then please stay tuned and listen for more. So in my last video, I discussed how you can land a job in the CVICU or ICU as a new grad. I wanted to take the time to make another video specific to what it's like working in the CVICU and what type of patients that you're going to care for and what the expectations are of you as the nurse. And so CVICU is an acronym. It stands for cardiovascular intensive care unit. And so whenever you hear ICU, it stands for intensive care unit. Whatever comes in front of that is specific to the patient population and the diagnoses that you are caring for. And so depending on what hospital you work in, what state you live in, it may be a different twist on CVICU. So you may hear CICU, which is cardiac ICU without the vascular component. You may hear CTICU, which is cardiothoracic ICU. And you may hear CCU, which is all the way completely a little different, which is coronary care unit. We all take care of cardiac patients. The difference is where they lie on the spectrum of whether they've had surgery, whether they haven't had surgery, whether it's a new diagnosis and an acute, very acute, or, maybe not so much. It depends on that. And it also just depends on that hospital and what they decide to call it. So my experience in the CVICU, I've taken care of all of the cardiac support devices, and I've taken care of patients pre-op, I've taken care of patients post-op. So when I say pre-op, before their surgeries, and post-op is after their surgeries. And so the type of devices that I have worked with and that you will commonly see in the CVICU is your balloon pump, which IABP, intra-aortic balloon pump. You have ECMO, you have LVAD and RVADs, which is your assist devices, left ventricle versus right ventricle. You have Impellas, and you also have PA catheters. And I mentioned PA catheters. It's not a device. Technically, it's more of a line. It's a central line, but it is specific to the cardiac setting. And so all of these devices, you have to have a thorough understanding of how they work, what they are doing for the patient, and if something goes wrong, how you can troubleshoot it. Of course, there's always someone you can call, or you should be able to call. But of course, if there's an emergency going on, you want to at least know the basics. So for example, an LVAD. You need to know how to change the batteries. You need to know that it's always connected to a power source. You need to understand a little bit of what your numbers mean, because a lot of these things you are charting every hour, on the hour, and you need to know what you're charting, what it means, because if something goes too low or too high, you need to know what it is you need to worry about and what it is that you need to communicate to the APP or the physician if there's no APP available. And so you need to take the time to learn those things. Another device, before I go into the next device, ECMO is something that a lot of times you have a perfusionist, and you'll hear them say they're sitting pump. So basically they're on the unit, for the whole shift, and they come in every hour, they, check the pump, they chart their numbers, and that's pretty much it. As a nurse, you can also be an ECMO specialist. You can become an ECMO specialist. And so you do the similar things as far as what perfusion does, but it's really specific to ECMO. You're not in the OR, doing all the other things that perfusionists do. But even if you're not an ECMO specialist, even if you're not the perfusionist, you still need to have an understanding of the ECMO device, the different configurations of the ECMO device, those cannulas, where they are at. All of those things are very important because you are spending the most time with the patient during the shift. And so you need to understand what is going on. It also is important as to how you will have to care for the patient if something goes wrong, as far as, let's say, they go into VTAC, or they go into VFib, or they go asystolic. Asystolic is very rare because, like I said, it's a cardiac support device. But my point is you need to know what type of ACLS is going to be provided for that patient if they are on ECMO, and what type of ECMO they are on, whether it's VA or VV, or, and I won't get into all the different configurations, but it does matter. So you need to know that. Another device that's not specific to the CVICU setting, but you will always commonly see it in the CVICU, is CRRT. So that stands for your continuous renal replacement therapy. So it is dialysis. And yes, you are a dialysis nurse too. As a CVICU nurse, you're going to have some dialysis in there too. You're managing that machine. It's all you. You have your orders, yes, but it is all on you how to manage that machine, how to change in those bags, how much fluid to pull off that patient every hour. That is all you. You need to have an understanding of how it works. It's not specific to CVICU. So yes, you'll see it in other ICUs, but a lot of times you will most definitely, if you don't see it anywhere else, you will see it in the CVICU setting. Other things like your PA catheter, that's specific to the cardiac patient population. And so you have continuous cardiac output. That is a device that you can hook up to the PA catheter to continue to get a cardiac output, or you can do a manual cardiac output. It really just depends on, again, what resources are available and what the physician wants for that patient. And so you need to have an understanding of those numbers. You need to know how to shoot a cardiac output, meaning how to manually do a cardiac output on that patient. And so that is specific to the cardiac population, but that does not mean you won't see it in other ICUs. But a lot of times if you see it in a patient in a different ICU that's not cardiac specialty, it's because they have some type of cardiac component going on, but maybe that ICU that they are in is better suited for the more pressing matter, let's say burns. So that is something else. Your drips. Drips refers to your IV medications, your intravenous medications. Most of the time, a lot of the drips that the patients are on in the CVICU are titratable. Some of them are not. And so you need to know which ones you can titrate and which ones you cannot titrate. And a lot of the titratable medications are vasoactive medications. Insulin is another one. It's not vasoactive, but it's another one that's titratable. So you may have to check a blood sugar every hour. But when I say titratable medications, like your vasoactive medications, you commonly have a MAP goal. A lot of times in the CVICU, especially from my experience, we focus on the MAP. So we don't necessarily, we look at systolic and diastolic too, yes. But a lot of times the physician or the surgeon will say, okay, this patient MAP needs to be greater than 65 and less than 90, or greater than 70, less than 90, or something like that. So let's say your patient MAP drops to 60. Well, you need to titrate your drips to meet your MAP goal. And that is nurse driven, because they expect you to know how to do that. They've given you your orders. They've told you what they want. It is up to you to manage that patient and to make sure they stay in a optimal state. And so that is all on you. You need to know how to pull central lines. You need to know how to pull PA catheters. You need to know what type of position the patient needs to be in for these procedures. You need to know how to manage arterial lines. In the CVICU, you commonly have patients with an arterial line, and that gives us our continuous blood pressure. We can also draw labs from that line. You need to know how to pull that line. You need to know how to troubleshoot that line. You need to know how to change the bags that come with the line. There are so many things that go into that. You also have chest tubes. So if a patient has, especially if a patient has had some type of surgery, a lot of times they will come back with chest tubes. Now, sometimes patients get chest tubes and they haven't necessarily had a surgery. They may have some fluid in, their lungs, or, around their lungs or something like that. But for the most part, if a patient has had some type of cardiovascular surgery or cardiothoracic surgery, then they will come with some type of chest tube. And so you need to know how to care for those chest tubes, changing dressings. You need to know if the chest tube is to gravity, what that means, versus to suction, how to hook up the suction, how to change the canister when it becomes full. You need to know all of those things as well. As far as your ECMO cannulas and your balloon pump and your impeller devices, wherever they are, on the patient body as far as entry site, you need to know how to care for those lines, how to be very careful with those lines so that they don't get snagged or pulled or anything of that nature. And so, you want to keep that in mind. Another thing, which is, you will see this in every ICU, so it's not specific to cardiovascular ICU, but your vent. You need to have at least the basic understanding of the different vent settings, right? Pressure support, pressure control modes versus volume control modes. You need to have a thorough understanding of that. Yes, you have a respiratory therapist. However, depending on where you work, and I have traveled to, certain CVICUs or ICUs, it really doesn't matter when it comes to the vent, that they were very short staffed when it came to respiratory therapists. So yes, you have a respiratory therapist. You can call your respiratory therapist, but the time in between that it takes them to get to you could vary depending on what's going on. So that's why it's good to have a thorough understanding, or just the basics of how to work the vent and the different vent settings. Of course, there are certain things you just don't want to touch too much depending on where you at, because they may not allow that for nurses. But something as simple as, if you need to go up on your oxygen, your FiO2, you need to know how to do that. If you need to give them a bolus of 100% oxygen, you need to know how to do that. If you're just having trouble, with the vent in general, you need to know how to bag your patient. You need to have ACLS, BLS certification, of course, and you need to keep that up to date, because you may be responsible for responding to codes. And so what I want you guys to take away from this video is that in the CVICU, you are taking care of the highest acuity patients. I say that from personal experience. I have floated to different ICUs. Hands down, in the CVICU, we take care of the highest acuity patients. So it can be overwhelming sometimes. It can lead to burnout for some people. So just pace yourself. Take time off from work if you need to. Make sure you invest in self-care, because you will need it. But, just keep in mind, you're not expected to know all of these things as a new nurse or someone who's never been in a CVICU. There's no way possible that nursing school can teach you all these things about the CVICU setting. It's just way too specific. And so depending on where you are, of course, they will train you. Now, how long that training is or orientation is, of course, varies. I personally went through a residency program, and so the education was very great, and I felt very comfortable coming off orientation, taking care of these patients, these sick patients. And that experience allowed me to go so many places and travel different places. Where I started as a new grad, I still work. I just work there PRN. And what I will say is, any CVICU I have traveled to or worked in, I will still say the acuity is the highest in the CVICU compared to other ICUs. So you have to be quick on your feet. You have to be very good with critical thinking. You have to be very observant. You have to be someone who is teachable. You have to be someone who's a team player, because you are collaborating with different disciplines. And so you may have a neuroconsult, you may have a nephrology, you have nephrology on board, and so you need to be able to collaborate and speak with the teams when they're rounding and things of that nature. Make sure you're always able to advocate for your patients, and that's just nursing in general. You need to have an understanding of how to titrate your drugs, how to titrate your different drips, how to manage a pacemaker, how to manage the wires, how to manage your PA catheter, how to troubleshoot your lines if something isn't working, how to work your CRT device, how to make sure all your cardiac support devices are, working properly, what they're doing for that patient, and what numbers you need to watch, what numbers are okay if they drop a little bit, what numbers are not okay if they drop a little bit. You need to have an understanding of all of those things in the cardiac ICU as the nurse. And so it can be very intense sometimes, and patients can go from 0 to 100 real quick. And so you need to, that's why I say you need to be observant, because you need to be somewhere in the area around so you can catch these changes. If you work in a hospital where the technology is, pretty good, where you can pull up your patient's vital signs and heart rhythm and EKG, all that stuff, in another patient's room so you can have a split screen. I always personally like to do that, because there have been so many times where I'm in I'm in a room with a patient, doing something for that patient, and my other patient decided to act a fool, meaning something happened. Maybe their blood pressure dropped. Maybe they went into VTAC. Maybe they went asystolic. Like, that has happened to me. And so you want to make sure that you're always somewhere keeping an eye on your patient. And if you are not keeping an eye on your patient, make sure you ask someone, hey, can you listen out for me while I go eat? Or I just need to take a minute. Or, I just need to take a quick little break. So with all that being said, I do thoroughly enjoy working in a CVICU. While it is a lot and it can be intense, like I said, the education that I got was very great. The education is ongoing, so it does not stop. So when I got off orientation and started, just doing my own thing, education is ongoing. Medicine is ongoing. There's always new, improvements and advancements in technology. And so make sure you're staying up to date with that. Make sure you pace yourself. It's okay. Take a deep breath, okay? It's okay. But I do enjoy working in the CVICU. I am so glad that I chose the CVICU, or rather the CVICU honestly chose me as a new grad, as a new nurse. It's not for everybody, but like I said, you learn a lot. And you can take that experience and take care of so many different type of patients. And so that's one of the things I enjoyed the most. And I also like dealing with patients with cardiac illness. And so I recommend the CVICU to someone who can keep up with the pace. I recommend shadowing a nurse or doing clinicals in the CVICU, or if you can't do clinicals, at least shadow a nurse for a shift or at least 8 hours so you can have an idea of what it's like, and go for it. It's okay. It's okay. And if it's too much for you, that's okay too. Try a different ICU. Try maybe burns. Try, maybe trauma, maybe neuro is better for you. Maybe surgical ICU, MICU, which is medical ICU. Try a different ICU, and if those don't work, try a different specialty. There's so many things you can do with nursing, and that's one of the most wonderful things about the nursing profession, is that you're never stuck. So if it's not working for you, then try something else, because that something else could be your new best thing. So I hope you guys found this video helpful. I know it's a lot of information. I tried to be very just short and to the point. And what I hope that you guys got from this video is what type of patients you are going to see in a CVICU, and also what is expected of you as a nurse to take care of these patients in a CVICU. Of course, if you have any questions, please feel free to comment them below. Don't forget to like and subscribe to my channel so that you can be the first to know when I post my next video. I will see you guys soon, and thank you so much for watching.